Hey guys, it's Marika here from Herasphere, and what we're going to do now is we're going to take that information that we've got from the theory video and we're going to turn it into something practical. So we're going to start with just talking about general posture and standing, and then we're going to do some work on all fours. So when we talk about the 5 key elements, often we teach it lying down on the back with the knees bent in a position we call crook lying. Now obviously for most of you, you're past 16 weeks, so we're not going to do that lying down, although you could actually do it wedged up on cushions and things. For the sake of ease, we're going to do it standing and all fours, and the reality is a lot of the exercises in the program are in those positions, so it's going to be a little bit more relevant. We're going to start with standing posture, and that of course is going to incorporate 3 of those 5 key elements. It's going to talk about rib position, scapular or shoulder blade positioning, and head and neck positioning. So we're going to cover that straight off the bat, and then we'll talk about the breathing and the centering in standing. So in terms of standing position, I always start at the feet. I think it's best to start with the base and work the way up. There's no point correcting this stuff until you've done what's happening underneath, because usually what I find clinically is if I sort all this stuff out, this stuff is really, really easy to fix, okay? So we're going to start at the feet. I want you to have a think about your feet as having two triangles underneath. So each foot has 3 points of control. So 1 under the middle of the heel, whoop, but not fall over. 1 under the middle of the heel, 1 under the big toe, 1 under the little toe. So you've got 2 triangles like this. I want you to have a little bit of a play around with that. I want you to shift your weight forwards and backwards. And you want to be feeling equal weight front and back, but also left and right. So if you find that middle position, it's going to be with your center of gravity probably sitting around about your shoelace kind of area. Yep. Toes are on the floor, but they're not gripping. As we move the awareness up the legs, I want you to check to make sure your knees are straight, but they're not locked back. So some people really push their knees back and tense their quadriceps muscles, their thigh muscles. And what that does is it does give you a lot of compression behind the kneecaps. So if you're one of those people who tends to flick their knees into hyperextension as well, it's good just to unlock the knees slightly. So your knees are straight, but they're not locked back. Now what I want you all to do is I want you to squeeze your thigh muscles. So I want you to tense your quads and I want you to push those kneecaps back. So that's too much. Now I want you to relax those quads. Your knees are still straight, but they're not working hard and compressing back, okay? Because we don't actually stand with our knees bent. That's really hard work. Our quads will be dying after a little while. So the knees are straight, but they're relatively relaxed. As we move up the legs, I just want you to think about what's happening at the hips. So in an ideal world, our kneecaps should be more or less facing forward. So for some people, they tend to rotate inwards and the kneecaps end up pointing towards each other, all right? So if you're one of those people, and especially if your feet tend to flatten out, can you think about opening up the hips and getting those kneecaps facing forward? All right, just give that a little go. So just think about that opening, that widening, that rotating outwards through the hips. And for some people, you might start to feel a little bit of action around the glutes as you do so. Beautiful. Okay, so let's move the focus up. So we've already corrected, all this leaning forwards and backwards stuff. So you found that middle position. But what I'm going to get you to do now is I'm going to get you to put one hand on your tummy, one hand on your lower back. And I just want you to lean forward a little bit, lean back a little bit. So just tilting at the hips. And just find that middle position where you're not getting too much action in your tummy, not too much action in your lumbar spine muscles. It's about equal, okay? So it's equal effort front and back. Now you might be wondering why I'm not doing a lot of the pelvic tilting stuff. And look, in years gone by, I used to actually get people to change their bucket in standing. So I would get them to tuck their tailbone under a little bit, or if they're really tucked under, I might get them to tilt forward. I still sometimes do that on an individual basis, but what I find is as a group, if I tell people who are really lordotic to tuck under, we just get a lot of this kind of stuff and a lot of butt squeezing and just too much excess work, and I don't know that it actually helps a lot of people. So I don't tend to do a lot of the butt tucking. or the tilting forward in standing. You're welcome to have a little bit of a play around with that, a little bit of tilting, and see whether it feels more comfortable for you in a position versus another. But I tend to work more on the center of gravity, so leaning forwards and backwards, a little bit of leaning forwards and backwards, and I find that works quite well. As we move up the body though, the one thing we do want to correct is the rib position. So we talked about that in the theory. So a lot of people we see tend to ring their bell forward, thrust their ribs out in front. We actually want to soften the ribs so the ribs are sitting over the pubic bone in a straight line, okay? So we want to make sure we correct that. Moving up the body, we're going to think about those collarbones. Now remember I said in the video, we don't want to be squeezing those shoulder blades together and sticking the chest out. Can you see that effect that it has back on those ribs, okay? So the ribs are soft, just a very gentle lengthening of the collarbones. You might feel a little bit of action between your shoulder blades and the muscles there, but don't force anything where it doesn't want to go, okay? So the shoulder blades are very gently drawn back. Now from that position here, the head and neck position is quite simple because it's just a very gentle nod of the chin and a lengthening of the back of the neck. So you're imagining that there's a string that's pulling you up towards the ceiling, and you can almost imagine your spine opening up segment by segment as if there's a string. You're a marionette. You're a puppet. No, you're a puppet. There's a marionette pulling on your strings, pulling you up towards the ceiling, little bit of a chin nod, so the back of the neck is nice and long. And when you're in this position, just have a little bit of a play around. Okay, so once I've got myself into my good alignment, when I relax, what do I do? So it might be this. Your center of gravity might come forward with your hips, and you might think, okay, I've got to back up now. I've just got to bring that back a little bit. Oh, actually, my back might feel a bit better in that position. If you notice that you do tend to do this, check out how does that feel. Okay, what happens if I try and just gently draw my shoulder blades back and tuck my chin in? Oh, okay, actually that feels pretty good. So you're just playing around, you're fiddling around, you're getting a sense of what your body naturally wants to do. Get it into what we would call a better alignment or a more optimal alignment, and then check how does it feel. So if in that new alignment you do something like you're doing like an exercise, you're doing a muscle strength exercise, think, does that improve my performance? Actually, no, it makes me feel weaker. Well, then I want to try something different. Or if you think, actually, that makes me feel really good, I feel stronger, or I have less pain, then that's going to be a good position for you. All right. So it's a lot of trial and error involved. So that's standing. The next thing we're going to talk about is breathing and centering in the upright position. So what I'm going to do is I'm going to grab my band, and if you've got your band with you, you can do this now. You can also use a scarf or a towel, and I'm going to get you to wrap the band around the bottom part of your rib cage, and you can just cross it over like that. I want you to think about that beautiful posture that we've just worked on, and I want you to take a deep breath in and out. Now, what did you feel in your band or your scarf? Now, if you're not using the bottom part of your ribs, nothing moves. What I want you guys to feel is as your ribs expand, you'll feel that tension and that opening through your band, okay? So it will start to pull open and widen. And of course, your tummy still needs to move. So just make sure that you're getting that crossing over, that movement through your band there, to make sure you're getting that nice rib cage movement, that lateral breathing. Okay, so now let's talk about centering. So you did a little bit of this in the theory. Let's try in standing. So if you want to, you can place your hands on the bony bits of your hips, go in an inch, down an inch, press in gently there. Okay, if you don't want to feel your abdominals, if you feel like you're already getting that nice flow over from your pelvic floor to your abdominals, then you don't have to do that. Just get into a nice alignment. You can close your eyes. Okay, so I want you to take a breath in. I want you to focus on your pelvic floor. So pubic bone at the front, coccyx at the back, the two sitting bones on either side. Draw those 4 points together, gently raise them up inside you and breathe. Relax, feel your pelvic floor descend and let go. So if when you're doing your pelvic floor contraction, it looks a bit like this. The rib cage has come up and out and you're very stifled in your breath, you know that you're sucking in your abs too much. Can you get a little bit more isolated, a bit more focused in the pelvic floor and the lower abdominals? Now we say isolated, remember what I said in the talk? Nothing is ever truly isolated, everything's connected. But what we don't want is too much action going on up here. So we'd really like to get more pelvic floor, a little bit of abdominals, still breathing and thinking about that sort of 25-30% maximum contraction. Butt's relaxed, thighs are relaxed, tummy is relatively relaxed. And then when you exhale, feel everything relax. Beautiful. Okay, so that's the 5 key elements in standing. What we're going to do now is we're going to take it down onto the floor. Now, when you're getting on and off the floor in pregnancy, there's a few different ways. Now, obviously, if you have something to hold on to, you can. Some women find that that's really useful as furniture. Coming down onto one knee, and then bringing that second knee down, and then onto all fours. Okay, so I'm just going to pause it there. Okay, so now you've come onto all fours. Let's talk about the neutral spine position through here. So typically what a lot of people do, especially in pregnancy, is as soon as they get onto all fours, you can see what's happening to my lower back here. Most people tend to sink into a big arch in the lower back. So I want you just to tuck that tailbone under slightly and think about tilting your tailbone away from you towards the wall behind you. You should have a gentle inward curve in your lower back. Your hands are sitting more or less underneath your shoulders. Now, through the top part of the back, you will be tempted to sink in through your chest. I want you to lift your breastbone away from the floor, tuck your chin in and lengthen the back of the neck. So if you have any discomfort in your wrists, I want you to go and watch the wrist pain video. Certainly one of the easiest options you can do while exercising is either using a rolled up towel or just rolling up the end of your mat, placing the heel of the hands on the mat with your fingertips just gently rested over. I know some people recommend coming onto the fists, but I don't find that my pregnant clients actually find that particularly comfortable. So I would always use a rolled up towel or the end of the mat is usually the most comfortable position. Okay, so let's talk about the 5 key elements. So let's start again with the postural one. So rib cage position, I want you to make sure that you're not allowing your sternum, your breastbone, to sink towards the floor. So think about that ringing bell position. Lift your chest away from the floor. Have a little bit of a feel of what's going on through your back. Okay, have you got a nice gentle inward curve there? Now this is very difficult to see on yourself, and this is actually where mirrors come in really nicely. If you have access to any mirrors so that you can watch yourself while you're doing the program, that is really, really helpful. So rib cage position. Now from there, let's think about the shoulder blade position. Let's try some shoulder blade, what we call protractions and retractions. Now, without moving your spine, what I want you to do is sink your chest down towards the floor by bringing your shoulder blades towards the spine. So it's like your shoulder blades are coming towards each other. And then I want you to lift your breastbone away from the floor, allowing your shoulder blades to wrap around the chest wall. So they're going to come forward. Now you'll notice that my head and neck aren't changing. My lower back is not changing. So I'm lifting, bringing the shoulder blades forward, and then I'm sinking and I'm bringing the shoulder blades back. Now this is actually a beautiful exercise to get that mobility, because a lot of people are a little bit stuck around the shoulder blades. Between the shoulder blades and the ribs get a little bit stuck just from sitting long periods, slouching, and just not generally moving the body in these directions. So I want you to practice this motion. And then through a lot of the exercises we do in more of that upward position here, that higher position. So on all fours, the head and neck posture that I typically see will be here. So the head will tend to drop forward and the chin will tend to lift away from the chest. especially if we start doing anything more challenging, for example, like a press up. So if we did a press up, this is what people will tend to do, is let that chin come forward and out, or doing some of the Superman poses like this, the head will drop forward and out. So I want you to think about your neck as being a continuation of the rest of your spine. So we don't drop it forward. The chin is in, the back of the neck is nice and long. I often say to people, imagine you have a peach, a soft peach between your chin and your breastbone. You don't want to squash your peach, and you don't want to drop it and let it fall away from your body. So keep that soft peach in. Okay, from there, let's do some lateral breathing. I want you to think about that rib cage expanding out and forward and up. Not as easy as it looks. Good, and then let's try that with the centering. Gently draw pelvic floor up inside you. You might feel your belly lifting slightly towards your spine. Hold that contraction gently. And then relax your pelvic floor and let it go. Okay, I want you to hold that position there. So hold your on all fours position, and we're going to try a couple of different cues and see what works best for you in terms of your pelvic floor. So I want you to visualize your pelvic floor inside you. Now, I want you to imagine that you're busting to go to the toilet and you want to stop the flow of urine. I want you to close off the front passage. So you need to go to the toilet, you're going to stop yourself from weeing. Feel that sensation and spread the sensation towards the back passage and gently lift those muscles up inside you. See if you can maintain that contraction as you breathe in and out a couple of times. Now if you feel it, let go, that's fine. That's just your endurance is not there, so you just got to work on that a little bit more. Okay, now let's try something different. Now I want you to think about the back passage. So you're having tea with a queen and you don't want to break wind. I want you to close the back passage and I want you to raise those muscles gently inside you, feeling that contraction spread from the back passage around to the front and hold. Make sure that you keep breathing. And then relax, and you should feel that contraction dissipate and let go. Now let's try another visualization. You can think about your pelvic floor like a lift, okay? So if you were to contract your pelvic floor as hard as you can, that would be level 10. I want you to gently take your pelvic floor to level 1, 2, and 3. Hold it there and breathe. And then gently take your pelvic floor down, down, down. Good, and relax. And you can come up into sitting like me. Okay, so what I want you to take away from that is that different people work better with different cues. So when I say think about your pelvic floor or draw your pelvic floor muscles on, I want you to think, okay, which one did I find easier? Was it thinking about the elevator? Was it visualizing the 4 points and bringing them together? Was it stopping myself from weeing? Was it stopping myself from breaking wind? Everyone's a little bit different. I want you to connect with what was the cue that gave you the best contraction, the more effective contraction. Okay, before we finish off today, what I want to do is just talk a little bit about getting on and off the floor and rolling over in bed. So through the program, we're obviously going to start in standing. We usually come down onto the mat. I've shown you how to get onto all fours, but from all fours position, you're going to be coming down into, say for instance, side lying and supine. So coming down onto your side, okay, and then rolling through onto your back. You should be doing it with bent knees. So typically if people want to get out of bed when you're not pregnant and you don't have any back pain or any issues, people will often just get up like this, okay? Now what you'll notice is as your tummy expands, you get that stretching through the linea alba, so through the connective tissue between your six-pack muscles, is if you start to do that a lot, is you might get some bulging in your abdomen. So you have to be very cognizant that you don't want to be putting too much tension through that tissue as it's going through these changes in pregnancy. So what we usually teach our pregnant women, and certainly our postnatal women early on as well, is just say you want to get out of bed, you bend the knees up, come rolling onto your side and gently pressing up with the hands. And if you're on the edge of the bed, you'll usually swing the legs over the edge of the bed and come up into sitting. If you're coming up from the floor, then you'll usually come up into this position here. Bring yourself over into kneeling. Bring one leg up. Now if you have any furniture, you can use the furniture to help you, and then come up into standing. Okay, now I've chopped my head off. I have seen people get off the floor if they have pelvic pain and they don't like having one leg forward. I have also seen some women tuck the toes under, walk the hands back, lifting the knees up and then pushing up. Okay, so if you have pain in the groin or pain at the back of the pelvis, sometimes you'll find it easier to come up symmetrically like that. Okay, so hopefully this has given you guys some good foundation training. If you want to come back and revisit this, please do so anytime in the program. I think it's a really good revision just to go through the postural things and that breathing exercise.